Well, it's hard to do. I've been doing it for over a week, and you're going between floors and you're bringing people food and you're picking up dishes, and God knows what I did that I forgot to look out for. But I did something.
So, what should you do if someone you live with tests positive for COVID-19?
So right now, the recommendation is, as much as possible, if that person is able to care for themselves, is to be as isolated from the rest of the household as possible. Now, again, this is, I'll repeat though, of course, still everyone should be vaccinated. If vaccinated and unboosted and eligible should get the boost, right? So we always want to have that. But even if they're all boosted, as much as possible that it's possible within the household, is to isolate that person away. Now, what the CDC is recommending currently is that that person should be isolated as much as possible for 5 full days. So that really means, as much, if one can, separate room to sleep, separate place to eat, separate place to use the bathroom, really to be not interacting with the rest of the household. If after those 5 days that person is better or continues to be asymptomatic, then what the CDC is saying that they can start now interacting. They don't need to isolate anymore, but they should still have the mask on for a further five days. Which means, again, that they need to eat separately from everyone else, but they can actually then go about and interact with people as long as they have the mask on. So that's what the CDC is recommending. I think it gets a lot more complicated when the person who's ill with the infection with Omicron actually needs to be cared for, right? And then you do have that, again, I think as much as possible, both the caregiver and the patient should be wearing masks, and then scrupulous hand washing in between interactions and things like that too, when the caregiver is interacting with other people.
I'm congested. I haven't sneezed as much today, but I had a sore throat today that I didn't have yesterday. It's not pleasant, but I've been sicker than this before, on the bright side.